CTCA is a hospital-based organization that offers very sophisticated, highly integrated cancer treatment for cancer patients throughout the United States.
We have all of the options that conventional medicine brings to bear in the treatment of cancer.
But we also understand that there's a psychological component and a spiritual component.
It's an integrative medicine concept, which is right on the cutting edge.
Patients who have cancer live with this 24 hours a day, 7 days a week. And they're frustrated, they're unhappy, they're distraught, they're probably in pain. They pick up the phone, and lo and behold, here is a real live person who understands cancer.
Good morning, Cancer Treatment Centers of America. This is Judy. How may I help you?
When you call any other hospital, you're going to get a call back in maybe 2 weeks. With us, you're speaking with a live person who's highly trained to answer their questions and help them facilitate a decision as to where they're going to treat. This is our first chance to let them know how we are different.
You can imagine it's critical to always have our systems readily available for them.
It is a very important part, a life-saving part, potentially, of what we offer.
It is really useful when we have a patient that's calling us for the first time to be able to instantly put in some identifying information.
Our phone system is linked into our CRM. It's an automatic integration.
Everything that we have across the country spans wide area networks and comes back to 2 centralized data centers that at all times are remaining in sync.
It gives us a platform to be able to enter the information that's going to be essential to us to make a decision how we can best help that patient.
This is a new patient that we haven't seen before.
We understand that people's lives are dependent upon the networking solution. You know, the demands and the complexity to keep that up is significant.
A cancer patient at home who needs to talk to someone because they're not feeling well, they can call one number and know that it's going to be answered by someone, whether or not that person's at their desk. That's a big deal. That's part of our commitment to the patients, and in fact we weren't able to do it prior to having IP telephony, frankly.
IPCC Enterprise solution provided by Cisco allows our sites to connect into a common call center queue where we could route our calls based on caller ID.
It's not just focusing on a piece of the network. It's not focusing just on voice. There's all these different parts that in order to have a healthy infrastructure, they have to be all working together in harmony, and we need to be able to build on the successes of other things.
Now with networking, we can send images electronically across to the radiologist and also to the patient's oncologist and any other physician who might need them within a matter of minutes after the time we finish the exam.
And it doesn't require getting out an envelope and printing a million images on film and mailing them to Chicago or mailing them to Philadelphia. They can literally have them in a couple of minutes. It's amazing.
It can move that information to people in the hospitals who are going to schedule. It can move information to people in our operations center who will be verifying insurance information. All these have to communicate seamlessly with each other. And the Cisco team, in my view, has stayed right with us and continued to be innovative and creative and responsive and effective.
All digital hospital, I definitely foresee that with the technologies that Cisco can provide.
If you can dream it, you can build it with the Cisco system.
CTCA did not have to invest in this technology. They could have left the old equipment and we would have worked through it, but now we are empowered to reach as many patients and our volume can increase dramatically.
They've given us the tools to work with. I know the objective of the leadership is to have Cancer Treatment Centers of America be the best place to work in healthcare.
When asked whether or not our patients would send their own mothers to our facility, 99% of them said that they would refer their own mother to this facility if they had to. And when we asked them their overall satisfaction with this particular hospital, the overall satisfaction was 97% of patients were highly satisfied. That's remarkable.
Thank you very much. Thank you.
We'll rely on the Cisco system to make sure that there's never a patient anywhere who is deprived of the moment of care because the information that they and their caregivers need is not available.